Today I'm really glad to be with Pascal Derycke. Welcome, Pascal.
Hello. Yeah.
Pascal, you're data engineer at Sciensano for a couple of years. And Sciensano is the Belgian National Public Health Agency. And Pascal, you have also a strong professional background in IT projects, from the project management side, but also from the data side, where, for instance, you acted as a data scientist for the European Commission in the past as well. And you are now involved in the development, for instance, of SEMIC application profiles like health DCAT-AP, so really for the health domain. And this is directly in connection with strong initiatives in which you have a role as well through Sciensano, which is the European Health Data Space 2, or the second pilot, which brings together actually many different actors in healthcare domain, whether national agencies, public health agencies, or research infrastructures around common goals such as how to enable linking and integrating data between different data sources across Europe. And this is one of the key pilots Europe and all those actors have put together in place as part of the European Health Data Space Initiative that I believe we are all aware of. And in that field, Pascal, can you explain what you are exactly trying to achieve with this pilot?
So it's you are referring to the EHDS 2 pilot project. It's a two-year project. It's a pilot project co-financed by EU for Health program, and we have a consortium of a strong consortium involving some member states, and we are. Our working plan is quite simple. It's a user journey for the secondary use of health data. And we are piloting the EHDS regulation, especially the chapter 4, where we are, in a way, implementing the proof of concept. And the user journey is simple. It's for a research team, from data discovery to the efficient reuse of sensitive data. We are speaking about health data, and health data is a bit special. I can tell you, for instance, for Sciensano, usually when you start to run a research project, accessing the data is a real challenge. It can take some years to have access to the data, sensitive data, and to be able to publish data. The idea of the EHDS regulation for the secondary use of data, and I'm only speaking about the secondary use of data, it's about trying to find a more efficient framework for the reuse of sensitive data. And Sciensano, my institute, has an important role in this. With our colleagues from Norway, we are working on the work package dedicated to the design of health DCAT-AP. So lingua franca for the discoverability of health data.
And that's very interesting because let's speak really frankly, yeah?
Yeah.
If you talk about reducing the time to get access to the data, what are we talking about? You mentioned years. What is your hope to bring it to days or a month?
So in the regulation, the expected time is 3 months. So you see, the reality is some years, and with the EHDS, we expect to have 3 months delay to have a positive answer for accessing data. But the most important thing is here we are at the SEMIC conference. You mentioned my experience in data. I've been involved in the implementation of Inspire. It's about environmental data, geospatial data. Now, this data space, geospatial data space, is really mature. We have interoperable geospatial infrastructures powered by the member states. But in case of health data, it's there, but we don't know where it is. We don't know what type of data is in our institutes in the death registries, the biobanks. It's a lot of data, and the situation is quite amazing. We've got a lot of data, but we don't know exactly what is available. And that was something we have discovered with the COVID-19 pandemic, is that we need to make our health data discoverable. That's one core requirement. And for this, DCAT is important because we have a lingua franca to make our data sets, I'm calling our health data, discoverable. And moreover, the EHDS is really a new deal. It will bring an operational infrastructure. I was mentioning, maybe it's technical, with Inspire, we achieve interoperable geospatial infrastructure. In the case of health data, we will have a health data at EU infrastructure, with all member states having a pathway to the health data. This pathway will be materialized by health data access bodies, which will be linked to a central place where it will be like a marketplace where you can search for data and then they will be, that's the beginning of the user journey, you will be able to discover the data, to understand the data, and to apply for it, for your research. So it's really enhancing research. And that's what the EHDS will bring for the European citizen. It's a common good, let's say, the health data at EU infrastructure. Great,
thank you. And as you mentioned, you are also active through Sciensano. It's actually the role you are taking also in the EHDS. Through that role, do you also notice already some impacts of those initiatives around the health data space at national level or sub-national level? Are there some challenges that you perceive here at those levels compared to the European level?
I mentioned the New Deal aspect. We speak about the EHDS a lot within our institute, I mean at Sciensano. We are working on a new data catalog, and the new data catalog will be based on this lingua franca, which is DCAT-AP. We are going to use health DCAT. So there's a lot of ongoing discussions internally. So you see, coming from the European vision, there will be a direct impact in our institutions. We will have a metadata catalog compliant to DCAT, so we will manage to have this interoperability. We are discussing how to have secure processing environments. Okay, here again, it's a bit technical, but it's sensitive data. So it's not because you are going to ask access to this sensitive data, but you will have access. You will access it as simple as this. No, it's also about creating trust among all the partners, among all the stakeholders and the citizens. So we are expecting with the EHDS to have this health data at EU, a federated infrastructure, which will bring trust among all partners. So we are speaking a lot of this impact of the coming regulation inside our institute, but it's also true at the national level in Belgium. We have already kicked off in January this year the Belgium Health Data Agency. It's operational, meaning it's there. We are organizing the departments, let's say, the people, we need people, and this health data agency will have major roles to play according to what is in the chapter 4 of the regulation. So you see, it's there, it's a new deal, and there's a lot of ongoing discussions, and the pilot, the EHDS pilot, was really an idea to start to validate the proof of concept, to have already something working where we can learn about it. And we are in a permanent the ping-pong discussion with the European Commission, where we exchange as domain experts. We see what they are going to, what will be the EHDS, and we exchange ideas about this. That's the purpose of the EHDS 2 pilot project.
Great, very interesting. And you talked about health DCAT-AP and the impact and the importance of DCAT-AP in the health data space and EHDS 2 pilot. What about, in a broader manner, semantic interoperability? How crucial is semantic interoperability to within the data spaces, but more specifically, of course, for the health data space?
At Sciensano, we say One Health, and I will say one data space for Europe. So meaning there's a lot, we should avoid this logic of silos. We see that data is gold when you reuse it. I mean, to produce data, you need to invest. And it's just logic to find a way to reuse this data and to produce insight, for instance. So health it relates to the environment. So let's think about environmental data space. That's the case, the Green Deal data space. How do we connect two data sets in order to produce insight? We need this interoperability at syntactic level and semantic level. And DCAT is there for this. There's one issue, it's to convince the stakeholders. That's the way to go.
And to convince the stakeholder or from other perspectives, what is the role you see for SEMIC in these developments?
So how can I explain this? For instance, we have a challenge with the quality. And in order, I'm coming back to the lingua franca, what is quality across all data spaces? We need a common framework for this. And the only way to go is to have a SEMIC trying to figure out what will be, for instance, quality labels or utility labels across all the data spaces. We are using DCAT as a cornerstone. How can we fine-tune DCAT in order to express the quality of these data across the data spaces? That's a major role for SEMIC. There's another one is to help us in building the data spaces. DCAT is a linked data technology. And when you have to work to bring the stakeholders, they are domain experts. And you need to bring the two types of experts within one room and to discuss exactly what we expect to have. Because
I also understand that there are a lot of ontologies, semantic standards already in healthcare in general, FEAR, SNOME, etc. There are things that are already recognized and implemented maybe differently across member states, across organizations, but how can SEMIC connect to this to make the most out of it? In the Data Act, there's a vision about publicly available resources for the common good. And SEMIC has to promote this idea. We also look at open source solutions. Simple is there to help member states to align to have this interoperable ecosystem of data spaces. So you need the building blocks there. You need a building block for the cataloging assets. You need also open, publicly accessible control vocabularies. You mentioned this aspect, which is important for enabling the semantic interoperability. Yeah. Great, thank you very much for those insights. Is there one last thing you would like to add on how SEMIC could act as a supporting activity or things SEMIC could do in the future better in order to maximize our impact on the community? You
are looking at the future. What I can say is I would like to look at the past, what we have achieved with the support of SEMIC. We had to design the DCAT application profile, and we got the support of SEMIC in doing this. Because you need to bring the domain experts from health with the semantic engineers together to discuss what we would like to achieve, what are the rules, how to extend DCAT-AP. And that was very important to be successful in what we have achieved so far and what we will do in the future. I was mentioning the quality, how can we address the challenge of quality of data sets across the data spaces.
Great. Thank you. It was a pleasure to have you today, and I would like to thank you very much for the time. And I hope to have the opportunity to talk soon around SEMIC, for instance.
You're welcome. See you next year at the SEMIC conference.
Yes, of course.